Colorectal cancer is the second leading cause of cancer death in the United States, and rates in younger adults have doubled over the past 2 decades. They're still climbing. But here's what most people don't realize. This is one of the most preventable cancers out there. If it's caught early, the survival rate is over 90%. And with the right screening, you can actually prevent it before it ever starts, by finding and removing growths called polyps before they can turn into cancer. So why aren't more people getting screened? Fear, confusion, not knowing where to start, and honestly, a lot of bad information floating around online. I'm Dr. Fadul, and today I'm going to walk you through everything: when to start screening, what your options actually are, and whether those at-home tests you keep seeing ads for can replace a colonoscopy, what the procedure actually feels like, what happens if something shows up, and what it's going to cost you. I'm going to keep it simple and give it to you straight. Stick around, because by the end of this video, you'll know exactly which test makes sense for you. Okay, let's dive in. If you're watching this and you're 45 or older, listen up, because you should already be screening for colorectal cancer. Both the American Cancer Society and the U.S. Preventive Services Task Force now recommend that average risk adults begin screening at age 45. That's a change from the old guideline of 50, and it happened because colon cancer rates have been rising steadily in younger adults for over 20 years. If you're a millennial or Gen Xer like me who just assumed this was an older person problem, it's not. Not anymore. And it's not just a men's problem either. Colon cancer rates are actually rising faster in younger women than in younger men. And a lot of people don't know that. Doc Kumi did an excellent breakdown on why this is happening. I'll link her video above when it's live. It's worth watching, especially if you're a woman under 50 who thinks this doesn't apply to you. Now, if you have a family history of colorectal cancer or polyps, meaning a parent, sibling, or child was diagnosed, you may need to start even earlier. The general guidance is to begin at age 40 or 10 years before your youngest affected family member was diagnosed, whichever comes first. This is something we help patients figure out at Bespoke Concierge MD all the time, because a lot of people don't even know their family history puts them in a different risk category. And for everyone under 45 watching this, you're not off the hook. If you're dealing with persistent changes in bowel habits, rectal bleeding, unexplained weight loss, or ongoing stomach pain, those symptoms deserve a conversation with your doctor at any age. Now that you know when to start, let me show you what your actual options are. And there are more than you think. Here's something that surprises a lot of people. Colonoscopy is not your only choice. There are actually 4 main ways to get screened, and different ones may be right for different people. Let me break down the basics for each one. Number 1, the gold standard, colonoscopy. A doctor uses a thin, flexible camera to look at the entire length of your colon. And here's what makes it unique. If they find a polyp, they can simply remove it right there during the same procedure. That's not just detection, that's actual cancer prevention happening in real time. Colonoscopy catches 89 to 95% of larger polyps, and studies show it can reduce colon cancer deaths by over 60%. You only need one every 10 years if results are normal. And for most insured patients, it's covered at $0 out of pocket as a preventive screening. The trade-off? You need to do a bowel prep the day before, which means drinking a solution that clears out your colon. I won't sugarcoat it. The prep is the least fun part. You also need sedation during the procedure, which means taking the day off and having someone drive you home. I know, if you're juggling work and kids and life, that feels like a lot. But here's the thing, it's the best choice to catch cancers early and deal with it definitively. Number 2, FIT, the fecal immunochemical test. FIT is the simplest and most accessible screening option out there. It's an at-home stool test that detects hidden blood in your stool, which can be a sign of cancer or large polyps. You collect a tiny sample at home, no prep, no diet changes, no stopping your medications, and send it to the lab. It detects about 74 to 79% of colorectal cancers and has a very low false positive rate. The catch? You need to do it every single year for it to work. One negative result doesn't mean you're in the clear. It only means no bleeding was detected in that specific sample. And if it comes back positive, you're going to need a colonoscopy to follow up anyway. I'm not a big fan of this, but it's certainly better than nothing. Number 3, Cologuard, the stool DNA test. You've probably seen the commercials for this one. They're hard to miss. Cologuard takes it a step further than FIT by combining blood detection with DNA analysis, looking for genetic changes that could signal cancer or precancerous polyps. The newest version, Cologuard Plus, detects about 94% of colorectal cancers and 43% of advanced precancerous lesions. That's significantly better than FIT for any cancer detection, and you only need to do it every 3 years. The downside, it still misses more than half of advanced precancerous polyps, the exact growths you want to catch and remove before they become cancer. It also has a higher false positive rate, meaning about 1 in 10 people without cancer will get a positive result and need a follow-up colonoscopy anyway. This is the option I recommend most for my patients who want to avoid a colonoscopy. I actually did a deep dive on Cologuard Plus in another video, how it works, how it compares to the original Cologuard, who it's best for, and the process of using it. I'll link that here if you want the full breakdown. Number 4, Shield. We're not talking about the Marvel Cinematic Universe here, we're talking about the blood test. Shield by Guardant Health is the only FDA-approved blood test for colorectal cancer screening right now. It's a simple blood draw, no stool collection, no prep, nothing to do at home. It detects 83% of colorectal cancers and is done every 3 years, but it has a major limitation. Shield only catches about 13% of advanced precancerous polyps. That means it's much better at finding cancer that's already there than preventing cancer from forming in the first place. That's why the NCCN guidelines currently recommend it only for patients who refuse every other screening method. It's a last resort option, not a first choice. Now, you may have also heard about the Gallery test. Gallery is a multi-cancer early detection blood test that screens for over 50 cancers at once, including colorectal cancer. It detects about 82% of colorectal cancers, which sounds impressive, but here's a critical difference. Gallery has essentially zero ability to detect precancerous polyps. We're talking about 0.5% sensitivity for advanced adenomas. So while Gallery is an exciting tool for catching cancers that don't have dedicated screening tests, like pancreatic or ovarian, it cannot replace dedicated colorectal cancer screening. Think of it as a complement, not a substitute. The NCCN doesn't include Gallery as a colorectal screening option, and even if your Gallery comes back clean, you still need your colonoscopy fit or Cologuard on schedule. You can check out my full breakdown on the Gallery test linked above. So, which of these tests should you pick? That depends on one big question most people get wrong. Can I just use an at-home test instead of getting a colonoscopy? This is one of the biggest questions I get from patients, from comments on this channel, from friends at dinner, and I want to be straight with you. At-home tests like FIT and Cologuard are legitimate guideline-endorsed screening options. They're absolutely better than doing nothing. If the choice is between a stool test and skipping screening altogether, just do the stool test every single time. But they cannot fully replace a colonoscopy. Here's a clear reason why. Colonoscopy is the only test that can find polyps and remove them in the same session. It doesn't just detect potential cancer, it can prevent cancer from ever developing. At-home tests detect signs of a problem, but they can't remove anything. And if an at-home test comes back positive, guess what? You're getting a colonoscopy anyway. Think of it this way. At-home tests are a great starting point, especially if you're someone who would otherwise skip screening altogether. As doctors like to say, the best screening test is the one you'll actually complete. But if you can do a colonoscopy, it gives you the most complete protection available. This is something I walk patients through regularly at Bespoke Concierge MD, figuring out which test fits your life. Because a 35-year-old with a family history has a completely different conversation than a 50-year-old with no risk factors who just hates the idea of a prep. Now, I know the number one reason people avoid colonoscopy isn't the science, it's the fear. So let's talk about what it actually feels like. Let's address the elephant in the room, because fear of the procedure is the single biggest reason people skip screening. And I get it, nobody's excited about this. Here's the reality. Most patients receive sedation, either moderate twilight sedation or deeper sedation, and they don't feel the procedure at all. Many patients don't even remember it afterwards. The procedure itself typically takes 30 to 60 minutes, and you'll spend another 30 to 60 minutes in recovery. The prep is the hardest part. And I'll be honest with you, drinking the solution and spending the evening in the bathroom isn't a great time. But here's how I frame it for my patients. It's one evening of discomfort that protects you for a full decade. That's a pretty good trade. The most common thing I hear from patients after their first colonoscopy, that was way easier than I expected. The anticipation is almost always worse than the actual experience. And if you've already decided you're doing the colonoscopy and you just want to know how to make the prep as painless as possible, I made a whole video on that too. Colonoscopy prep tips, the best prep options, taste hacks, timing tricks, all of it. I'll link that for you right above. As for serious complications, bowel perforation happens in about 3 to 4 out of every 10,000 procedures. That's less than 1/10 of 1%. This is an extremely safe test when performed by an experienced provider. Okay, so now you know your options and what to expect. But what happens if something actually shows up on your test? Don't panic. Here's exactly what that looks like. First things first, an abnormal result does not mean you have cancer. That is probably the most important sentence in this entire video. So let me say it again. An abnormal result does not mean you have cancer. If polyps are found during a colonoscopy, they're usually just removed right there on the spot. Your doctor sends them to a lab to check whether they're precancerous or benign. And then they tell you whether to come back for your next screening, which could be 3, 5, or 10 years, depending on what they find. If you get a positive result from FIT, Cologuard, or Shield, it means the test picked up a signal that needs further investigation. You'll need a follow-up colonoscopy. Most of the time, the finding is a polyp, not cancer. And even if cancer is detected, catching it early makes a massive difference. Localized colorectal cancer, meaning it hasn't spread beyond the colon, has a 91% survival rate at 5 years. The bottom line, an abnormal result is not a death sentence. It's your body giving you a head start. One more thing people always ask about, the cost. And there's one billing trap you need to know about before you schedule anything. If you have insurance, a screening colonoscopy is covered at $0 out of pocket under the Affordable Care Act. Medicare covers it too, no copay, no deductible, for anyone 45 and older. FIT and Cologuard are also typically covered at no cost for insured patients. But here's a billing trap you need to watch out for. If your colonoscopy is ordered because of symptoms instead of as a routine screening, it may be classified as diagnostic, and that could trigger out-of-pocket costs. Some patients have literally gone in expecting a free screening, had a polyp removed, and received a surprise bill because the procedure got recoded. How to protect yourself? Confirm with your insurance ahead of time and make sure your doctor codes the procedure as a preventive screening when it applies. This is one of those behind-the-scenes things we handle for our patients at Bespoke Concierge MD, making sure the paperwork matches the intent so you don't get caught off guard. Here's what I need you to take away from this video. If you're 45 or older, it's time to get screened. You have real options, from a quick at-home stool test to the gold standard colonoscopy. None of them are as scary as a disease they prevent. And the earlier you catch something, the better your outcome. At Bespoke Concierge MD, we make this whole process simple. We help you figure out which screening option is right for your age, your risk factors, and your lifestyle. We coordinate your labs, your referrals, and your follow-up, so nothing falls through the cracks. If you want a doctor who actually knows your name, knows your history, and takes the time to walk you through decisions like this, visit BespokeConciergeMD.com or click the link in the description. Your future self will thank you. And if this video helped you even a little, share it with someone you care about who's been putting off their screening. It might be the nudge they need. If you have questions about how to get ready for a colonoscopy, the video on the right breaks down my colonoscopy prep tips and tricks. The playlist on the left covers colon cancer prevention and related issues in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.